We are digging deeper tonight into the crisis at the Oregon State Hospital.
Last week, we told you how the mental hospital in Salem is calling on the National Guard for help because of a nursing shortage. It's a symptom of the larger mental health crisis. Tonight, our Dan Tilkin investigates what's driving it and what's needed to turn the corner. Dan, I know this is something you've been investigating for a while.
And this is a big deal. The state hospital treats the most severe mental health patients in Oregon. And the system it's part of is bursting at the seams, even though overall, the state is spending over $3 billion on behavioral health.
Probably no simple solution.
In April, the man who directs the state's mental health programs told lawmakers what he's facing.
We are in a really untenable position with our state hospital, in which we have almost no capacity right now to admit people under civil commit, which puts a tremendous pressure on the rest of the system.
In the last several years, the number of patients who are sent to the hospital to determine if they're fit to stand trial has increased dramatically compared to patients not accused of committing a crime. That share from the criminal courts is 69% of the more than 500 total patients at the Salem Hospital, compared to about 11% a decade ago.
And those patients are sicker than our general population.
Add to the stress, as of April, 30 patients and 120 staff members have tested positive for COVID during the pandemic. Nearly 700 employees have taken some sort of COVID leave.
We are in the midst of a crisis.
To ease the pressure long term, the Oregon Health Authority says it needs to open 2 units at its facility in Junction City, which have never been used since the facility opened less than a decade ago. Well, that's not cheap. At a cost of $31 million, the state could treat 360 more people. That's only part of the solution. The health authority told lawmakers the state needs to also invest in residential treatment homes for young adults, as well as housing assistance for people leaving mental health treatment, and invest in helping patients find work to break the cycle of people returning to mental health crisis. One bill in the legislature would fund more mobile crisis units. Another would establish a 3-digit mental health emergency number like 911. So Liz and Jeff, people would dial 988, but that would need to be passed by the legislature.
All right, Dan, difficult but important story. Thanks for staying on top of that.